Okay, so I'm Laura Chilcutt. I am a pediatrician and based here in the Orlando hospital. I actually was at Nemours as a medical student for a couple of years, and then as a resident as part of the first class of pediatric residents here in Orlando. And then now I'm here as faculty. So today I'm going to just talk for a couple minutes about what I'm doing with social programs and evaluating the effectiveness of those programs and kind of the importance of including research. Um, a lot of times people like me who do these kind of programs, we don't like to do the research part, but from my first career, I realized that this is a really important thing that has to be done if you want the funding and to be able to advance your career. So a little bit about me first. So I was a legal aid attorney. I represented immigrant victims of human trafficking and domestic violence. I did that for a couple of years, graduated from law school back in '08. And at that time, the economy was crashing. I went into private practice after that contract was over, and then ended up deciding that medicine was a good place to kind of continue my work and be able to still find a position. So I went back to school, did 10 years of undergrad and then med school and then residency training and then finished 2 years ago. So it's been a very long process, but it does give me a good background because I've got kind of that extra background of the legal and policy understanding of how things work and why things are the way they are. So I'm now medical director of medical social impact here at NCH Florida. I do 1 day a week of pediatrics, and that's actually in the resident clinic, which is a great place to be because I get to interact with the learners, but also they need a lot of research, they need experience with different kinds of projects. So it's a good way to partner with them and to find ways to get help with some of my projects, but also to train the future physicians. A lot of times physicians don't learn about integrating kind of that social type of work and SDOH type of work into their practice. And so getting that in early and letting them see how they can integrate that is really important. I also work with our policy team in the external affairs office. I have time through GME. I oversee the advocacy rotation of the residents. And then the other 40% of my time is spent building programs within the hospital. So as a resident, I built our mobile clinic. We still run that. It's supposed to be about once a month, hasn't been quite as consistent as I'd like, but it's still a way for us to get out into the community. We work in different areas in Apopka, which is a big farm worker area, and then we work with the Mexican Consulate, Hispanic Federation, so kind of all over Orange County, really trying to be out in the community, get the Nemours name out there, but also see where patients really are, as opposed to seeing them when they come into the hospital, or it's easier to understand where they're coming from when you get into their neighborhoods. So that's also a great teaching tool. We have medical students and residents who work with that as well. Family Resource Center, we just opened up a couple months ago. That is here, like off of the lobby in the hospital. We have built up a database of hundreds of resources around the community from our kind of local counties as well as counties that are a little bit further out because we do serve a very large area of Florida. So it's a way for when families come in and we recognize that they have concerns about transportation or food or housing, we're able to get with them and try to find some resources for them local to where they live. We do have food boxes from Second Harvest that we give out. So that's a box of food for a family of 4 for a week. So it's something where if they're about to go home, they've been in the hospital for several months and they have no food at home, we want to make sure that they've got something to get started with. And then I'm always looking for new projects. So I've got a lot of different ideas and we'll see which ones I get to next. So to work with that as well. It's about why is research worth the time? And this is just kind of some lessons that I got, especially in legal aid, where we were not focused on research. Our time was all grant funded. Everything was about how many clients we could see, how many people we could help. But I noticed that as we were doing that, we were helping lots of people. But if somebody left the organization, there was no documentation of what had been done. There was no real demonstration of the work that had been done over the 10 or 15 years that the team I was working with had been doing what they were doing. Not only that, other organizations would come in and ask for data and work with them, like not in a mean way, but they would just like say, like, can we get some information about what you've been doing? And then they would publish the information. And again, not like intentionally stealing their work, but just as a way of like if you don't publish it and you don't document what you're doing, someone else is going to. So for me, research really became an important way of documenting what I was doing. And these 3 reasons, right? Evaluating your effectiveness. If you aren't keeping track of what you're doing and trying to find ways of measuring what you're doing, which is really hard in this kind of social type work, working within the communities, measuring that something that you do now affects the number of times someone comes into the hospital over the next few years. Like that's really long-term research and it's hard to measure. So finding things that you can measure short-term to be able to just publish something to show that what you're doing is worth your time, to justify your time and your salary, but also That's number two here, getting access to funding. I mean, everything I do is grant-based. So the mobile clinic came from an initial grant of $25,000 from TD Bank. The Family Resource Center initially was no funding, but it's all staffed by volunteers. So it's all UCF undergrad students that are like pre-med students and pre-psychology students. So I have a team of 30 of them that are really like staffing the entire thing, which is fantastic. But that's still you're constantly having to find ways to get resources, right? And then after I started recruiting them, I got a donation of $30,000 from Edith Bush Foundation, and so that helped us to purchase computers to build a computer lab so that families could have a way to access internet and to print out forms that they needed to. It's what pays for the food boxes from Second Harvest and other resources that we have there. And that's as I expand this, I'm hoping to be able to eventually have someone whose full-time job is to oversee that. Right? It's like right now I'm overseeing all these volunteers while I'm also trying to do other things. So having someone whose job it is to oversee that, probably a community health worker or something else of that sort, would be a really important resource for us. And then career advancement. This is another big one, especially for pediatricians. We tend to just do a lot of things and not really keep track of what we're doing or to document it. We just think of it as it's just part of our job. Like advocacy is it's a big part of taking care of kids. A kid comes into the hospital, they don't have a certain resource, you help get them connected to that, and then you move on. But making sure that you track these kinds of things so that you can demonstrate where you've spent your time. This is important for if you're looking for like professor positions, but also just keeping track again and justifying your salary and what you're doing and being able to show that you're contributing to the organization. Just a little bit more about those things. So evaluation, the big question there is always like, are we doing the right thing in the right way? We a lot of times think we know what people need or how something should be done. But if we don't involve people from the community that are actually helping and ask them, what exactly do you want? Or what do you need? Or like, is what I'm offering really the most important thing? Sometimes you think that's what they need, say, is I've seen some programs, I think, on like exercise. And so this with a research program, they were going to offer new pairs of shoes and exercise equipment to this group. And the response really was, well, we don't have enough money for food. We don't want fancy sneakers. We'd rather have that for food. So making sure that when you're creating programs, you're really going back and including that community and then evaluating, is this making a difference? Because you could spend 10 years spending a lot of money and a lot of time and resources creating a program and then get to the end and realize it didn't matter because we weren't doing it right or we just weren't getting to the right population or we were getting to them. But the moment we stop doing this, the effect goes away. So it's really important to keep looking at that. And this is something again that often gets forgotten, especially in like nonprofit work. People get very focused on what their vision is for the nonprofit, and that almost becomes the purpose as opposed to helping the people that they started out to help. And so this is a good way of kind of bringing you back to your like that reconnect to purpose kind of thing. Um, and so this, I don't need to go too deep in this, but kind of what we're looking at with the Family Resource Center, mixing that quantitative numbers because one, for philanthropic dollars and for grants, people want numbers. They want to know numbers of people, numbers of families, numbers of resources you handed out. We do things like we track number of books that we give out, number of boxes of food that we give out, how many people come through the Family Resource Center, how many people are we helping? So if we help 5 families, but there's 40 people total in all of those families or the households, those numbers add up, and that's what looks good to funders, in addition to just being able to show the hospital that we're making a difference. And then those qualitative things also, including those interviews, doing small group interviews, talking to families, that can also give you that really important feedback to know, are we making a difference or do we need to completely revamp how we're doing this because what we're doing isn't what that family or that population is looking for. And then again, this is what leads to funding. People like stories, especially if it's private philanthropic dollars or even a big organization. They want to be able to tell stories about the families that they help to support. So you want to have those numbers for them, but then you're also going to have the stories. So it's kind of a pseudo science really when you're looking at funding. But this is a really important thing to include. Kind of like when you read a newspaper article, right? That first paragraph is always that hook, some kind of good story about what's going on. And so that's a big piece of how I look for funding. And then again, the career. And there's a lot of stuff at this point on, especially with pediatrics, creating that alternate portfolio lessons that I got a spending portfolio up here, bench research, creating kind of a parallel version of that with stories about your research and advocacy and programs that you do. But turning it into research really makes it look a little more academic and makes people who are used to that traditional academics, they understand it a little bit better. and it makes it easier for them to say, okay, I understand what you're doing compared to, say, someone else who's doing pure academic or bench research or the more traditional types of research, and they can kind of compare it and say, okay, well, it makes sense then to promote you in line with that person. Because it's hard if you can't make it somehow comparable. It's hard for people to understand how do they advance you to keep you on par with your peers. And these are just a couple of projects that we have going on. I already mentioned the Philly Resource Center, asthma project. That's when we got a small couple $1,000 grant from the AAP for some residents. We basically took the residents out into the community during the back to school events, and we'll teach kids who have asthma how to use their spacers and their inhalers, because usually that's the reason they end up in the hospital or in the clinics, is because they don't know how to use them properly. They don't have a spacer. So we give them a spacer, we teach them how to use it, and then we have them do the teach back. And then the plan with this is to call them in 3 months, 6 months, a year, and see, like, did what we do affect the number of times they had to go to the hospital or go to clinic or miss school. And that was just kind of a way that we're thinking of measuring the effectiveness of the program. So that's a very quick overview of the kind of stuff that I do and the research that I'm working on. Any questions? Anything else you'd like to hear about?